Smog is a serious problem in many cities and continues to harm human health. Nitrogen dioxide and carbon monoxide are especially harmful for senior citizens, children and people with heart and lung conditions such as emphysema. Hospital admissions and respiratory deaths often increase during periods when ozone levels are high. An experiment was carried out using intense air pollution similar to that of the 1952 smog of London. The results from this experiment concluded that there is a link between early life pollution exposure that leads to the development of asthma, proposing the ongoing effect of the gray smog. Modern studies continue to find links between mortality in the presence of smog. A similar study in Xi'an found an association between ambient air pollution and increased mortality associated with respiratory diseases. This study highlights the effect of exposure to air pollution on the rate of mortality in China. The Ontario Medical Association announced that smog is responsible for an estimated 9,500 premature deaths in the province each year. A20-YEAR American Cancer Society study found that cumulative exposure also increases the likelihood of premature death from respiratory disease, implying THE8/HOUR standard may be insufficient. Alzheimer's resistant magnetic particles from air pollution have for the first time been discovered to be lodged in human brains, and researchers think they could be a possible cause of Alzheimer's. Researchers at Lancaster University found abundant magnetite nanoparticles in the brain tissue from 37 英寸地, which is associated with neurodegenerative diseases including Alzheimer's. Risk of certain birth defects study examining 806 women who had babies with birth defect between 1997 and 2006 found that smog in the San Joaquin Valley area of California was linked to two types of neurotype an emergent cohort study in China linked early life smog exposure to an increased risk for adverse pregnancy outcomes. Low birth weight according to a study published in The Lancet. Exposure was associated with an increase 18% in risk of a low birth weight at delivery.